Welcome to the Library Knowledge Service recorded session on using APA PsycInfo on the Ovid platform. This recording is designed to give you a practical introduction to using Ovid to access APA PsycInfo, which is an essential resource for anyone working in mental health, psychology, or related fields. Before we look at the APA PsycInfo database, here is a quick reminder of what your GMMH Library and Knowledge Services team offers. We provide access to books, ebooks, journal articles and databases. We also offer literature searches and several monthly current awareness bulletins. In terms of our training offer, we provide monthly effective literature search training sessions bookable via medical education, and we can organise additional separate one-to-one support for more tailored literature searching. You can find more about our services on the GMMH Library website, which you can access via the QR code or the link on the slide. The aim of this session is to introduce you to the Ovid platform and show you how to access and search for the APA PsycInfo database. It is not a full literature search session and will provide a brief overview of the Ovid platform only. By the end of the session, you will hopefully have gained the knowledge and skills to navigate to the PsycInfo database on the Ovid platform, perform a basic search, and create a personal Ovid account and use it to save searches and results, as well as set up an alert. So what are Ovid and PsycInfo? Ovid is one of the platforms we use to access a range of databases, including APA PsycInfo, Medline, and Embase. It is widely used across the NHS and academic institutions. You may already be aware of or may have used APA PsycInfo, as we have had it for many years, but it was previously hosted on the ProQuest platform, which looked a little different. As of July 2025, our access to the APA PsycInfo database moved to the Ovid platform. So APA PsycInfo itself is a bibliographic database produced by the American Psychological Association. It covers psychology, psychiatry, and behavioral sciences, with over 5 million records and 144 million cited references. It is updated twice weekly and includes content from journals, books, and dissertations. And once you know how to use APA PsycInfo on the Ovid platform, you can then apply the same principles to Medline and Embase, for instance, on the same platform. To access APA PsycInfo, go to the NHS Knowledge and Library Hub. You will need to log in with your NHS OpenAthens account. If you do not yet have an NHS OpenAthens account, you can register via the NHS Knowledge and Library Hub, and it is quick and free. Or if you have an NHS OpenAthens account but cannot remember your details, please get in touch with us and we can send you a password reset email from the system. Once logged in, click on Further Resources and then Databases Ovid. So we will now move on to the live demonstration, where we will show you how to access APA PsycInfo on Ovid, starting from the NHS Knowledge and Library Hub, perform different types of simple searches, and use the platform's features such as My Account. So you will first need to go to the NHS Knowledge and Library Hub using the URL www.library.nhs.uk/GMMH. Once you log on to the NHS Knowledge and Library Hub, you need to then also log into your OpenAthens account using the grey toolbar at the top where it says Welcome Guest. You may sometimes need to re-input your PC or laptop password or PIN number when you're logging in, and you may also be sent an access code by email to input in order to sign into the hub. After this, you will be signed into the GMMH instance of the Knowledge and Library Hub. You can access further links to our library services from there, such as accessing the library catalogue or creating a separate library account. But for the purpose of this session, we will go to Further Resources on the left-hand side column. So under Further Resources, you can also see other nationally and locally subscribed to resources available for you. such as other databases available via the EBSCOhost platform, for instance, or BMJ Best Practice and clinicalskills.net. So to continue going onto the APA PsycInfo database, you will need to select Databases Ovid and then select APA PsycInfo database, which I will show you in the next slide. So we will now click on Databases Ovid, and this will open a prompt screen asking you to select which resource you want to search. You can select several databases at once, such as Medline and PsycInfo. However, in multi-database sessions, some advanced features, like subject heading mapping, are limited, and we recommend to search each database separately for complex searches. So for the purpose of this session, we will select the APA PsycInfo database only. So once you're in the main search screen, you can switch databases if needed by clicking Change above the current selected resource at any point. So there are four main search modes: basic search, which is best for quick queries and where you can type your topic as a question; search fields, which lets you search specific fields like the title or abstract fields from a record; and advanced search and multi-field search, which are more complex and are covered in our literature search training. So next to the main search modes, you can also see two other tabs: Field Citation, which helps you search for specific records, and Search Tools, which helps you discover more about the relationship between terms and subjects within the context of APA PsycInfo. So at the top, you will also see tabs for journals, books, multimedia available on Ovid, my workspace, which we will cover later on, what's new for any updated notifications, and a very useful help section. So going back to basic search, Ovid uses natural language processing, so you don't need Boolean operators that link words like and or. The Include Related Terms box is ticked by default to expand your search, and you can leave it as it is. So as an example in basic search, we will now search for is clozapine an effective treatment for schizophrenia? So in the results, you can see the search history, which appears above the search box, and you can see I found over 13,000 results. And then below that, you can see the search results, which include a search information menu on the left-hand side of the screen, which will indicate what search terms have been used to retrieve your results, which is useful if you have selected Include Related Terms button, and will also offer filters to narrow down the results. The relevancy ranking, which we've also seen, which gives stars out of 5, will show how well the results match your query above each result. And please note this is only available in the basic search function. Also, you'll notice that some words are highlighted in yellow and in green. So if the words are highlighted in yellow in the records found, this indicates an exact match with your search, and words highlighted in green in the records found indicate related terms. You can also adjust the view to only show the title from the records found or show more details including the abstract, and you can adjust the number of results displayed as well. And as you can see, you can view from 5 to 100 results on one page. So for full text access to an article, you can use the LibKey Nomad Get Full Text button. And if it is missing, you can contact us to get instructions on how to install the LibKey Nomad browser extension. So once you click on the Get Full Text, if the full text is available via national or local subscription or is available open access, you will see different access options if there are more than one access routes. If the external link resolver libkey NHS option is available, please choose that option and you will see a download PDF and or article link button and potential retraction alerts, including contains retracted citations, before you proceed to the article. And once you're on the PDF document, you can also download it or print it, for instance. So looking at another article, for instance, if the full text is not available via subscription or open access, you will be redirected to a request this item prompt screen, which will already have the record details pre-populated and where you just need to add your contact details. This will be automatically sent to our library mailbox and we will try to source it for you. And finally, one thing to mention is that you can click on the title of any of the search results to view the full details of the record, including subject headings, which are very useful for more advanced searching. So we will now look at how to perform a search using the search fields function. This gives you more control by letting you choose where your search terms appear, for example, in the title or abstract. You can also use it if you need to use the traditional way of searching databases by breaking down your search query into individual terms and concepts. So to perform a search, we will use the same search topic as before, is clozapine and effective treatment for schizophrenia. But this time, using the traditional way of searching databases, we will search separately for the terms clozapine and schizophrenia. So first we will search for clozapine in the title and abstract fields. Then we will search for schizophrenia using the same fields. And then to give us a bit more detailed answers, we can also add the search term treatment using the same fields. So you will see your search history at the top again with the 3 new searches, and the active search line is highlighted in light blue. And you can see the fields you search for in the search history have got .ab, ti after the word, which means that those are the fields searched for. So you can then combine individual searches using Boolean operators, and so this lets you combine different concepts and make sure that the results you retrieve have to include all 3 concepts. So as an example, just looking at our results, we got over 9,000 results for clozapine. We got over 117,000 results for schizophrenia, and we got over 714,000 results for treatment. But when we combine now all 3 concepts, we will get a much lower result. So we're combining it with and now we're getting a little under 4,000 results, which is more focused than the 13,000 results from the previous basic search. So you can then refine results further using filters like publication date, and as with the basic search, you can use the left-hand column to find all your filters. And something to be aware of as well is that in search fields, the functionality is classed as an advanced search, and it is not possible to combine rows in the search history from a basic search with rows from an advanced search. So once you have run a search, it is important to know that previous searches and search results will not be saved automatically and will disappear by the next time you access the Ovid platform. It is therefore really useful to create a personal Ovid account by clicking on My Account at the top of the page and then Create Account, where you just need to input some basic details about yourself. This will let you save your search strategies, save your search results, and organize them in project folders and set up alerts as well if you wish to. And once you have set up an account, you can sign into your account to access what you have saved under My Workspace. So My Workspace is a great way to keep track of your research, especially if you're working on multiple topics or want to keep working on a topic over time. So under My Workspace, you have three areas. You've got My Projects, where you can save and organize search results into projects. Then you have My Searches and Alerts, where you can save, copy, and edit search strategies, rerun them as well, and also save alerts. So I'm just showing you how you can edit a strategy, for instance, and you can then edit each individual line of the search as well. And you can rerun it as well. And you've also got the alerts at the bottom, where again you can make changes to those if you want to. And then the third area is My eTocs, where you can search for individual journal titles within Ovid and subscribe to electronic table of contents called eToc alerts for your chosen journals. So we will now save the searches we previously ran on clozapine and schizophrenia. So when you're saving, you don't need to select all of the different steps. As long as you select the final one, which includes the steps you're interested in, it will save the whole search history. So you can then give a name to your search strategy that you can retrieve again in the future. And you can also choose whether you want to save it temporarily for 72 hours or permanently, or whether you want to save it as an alert. So for this purpose, we will save it permanently. And then, as you can see, we can find it again under My Workspace, My Searches and Alerts. And if you want to, you can also make any changes there. Another useful functionality of My Workspace is that you can save and organize your search results records. You can either save individual records or you can save several records at the same time by clicking on My plus My Projects, either on the record itself or on the top right of all the results. And then when you do save the results, you can choose to add them either to an existing project or create a new one. And then you can find them again under My Workspace and My Projects and the actual name of the project. And you can access, export, or remove records at any point from there. Ovid makes it also very easy to print, email, or export your results. And you can do this either from your original search results or from the records you have saved in a project. So for instance, you can export your results into Word, Excel, or a citation reference manager like EndNote or RefWorks. And it is also a good idea to select the link to external resolver, as this will include your library access and link resolver in the export and allow you to request from us any items you cannot access full text directly. So once you've pressed export, it will open a Word document, and there you will see the search history saved as well as the two records. One of them also includes the references with the links to access those references. And for the second record, you can also see at the end that there is a link to LibKey NHS, and that will allow you to open the full text of the record as a PDF, as we've seen previously. Finally, you can also share your search history with others, and you can do this by emailing the search history or copying a search history link, or copying the search history details, which can be useful for reporting if you need to show your search strategy. So as an example, I've copied it into a blank Word document. So this brings us to the end of the live demonstration, and hopefully you have found it useful. So we will quickly go through the key takeaways from today. So Ovid is a trusted platform and your gateway to APA PsycInfo and other key databases. APA PsycInfo is especially valuable for mental health and psychiatry. You can access it via the Knowledge and Library Hub via your NHS OpenAthens account. And also don't forget to create a personal Ovid account to make the most of the platform and save your work. And please do take some time to have a look at the Ovid platform and APA PsycInfo database. There is a very useful help section where there are quick videos on basic and advanced searching. And if you do have any further queries, don't hesitate to get in touch with us at the Curve Library. And also, we would really appreciate if you could take a moment to complete our feedback form, as your insights are really valuable in helping us improve and tailor future training to better meet your needs. Thank you. Finally, we're always happy to support you with your research and information needs. We're based at the Curve Library in Prestwich and are open Monday to Friday, 8:30 a.m. to 4 p.m. And you can see on the slide the different methods you can contact us. So thank you very much for watching this recording. We hope you found it helpful and informative, and we wish you a great rest of your day.